And I wanted to create a short video here to help explain the Part D reports. That's Part D for drug plan that come out of the new Medicare Plan Finder tool. You're watching this video either because you're just curious about these reports and how to read them, or you might have received an email from us regarding a recommendation for a Part D drug plan. And this video, it's supposed to just give you a quick tutorial on how to understand these reports. We have other videos out there that explain how we pick the most cost-effective drug plan, how Part D of Medicare works with the different phases of Part D. But this video is really just specifically to understand how these reports work. So for this individual, the most cost-effective plan happened to be a plan called WellCare Value Script. It gives you the monthly premium. That's the amount you pay the insurance company each month for the coverage. The deductible, which in most cases is really only for the higher tier brand name drugs. Most of the generics do not apply to or at least the tier 1 and tier 2 generics do not apply to the deductible. But that's some general information on that first page of the report. On the second page, it gives you just a little tier breakdown cost. If you use a standard pharmacy, what the copays would be for each of the 5 tiers of drugs in the initial coverage, the donut hole or coverage gap, and the catastrophic phase. All right. But where it gets really interesting is on the third page of the report, where it breaks down the costs by the pharmacies you've selected. This individual happened to select CVS and Walgreens, so we'll show you how you can read these reports. And for each of the pharmacies is also for mail order if you're getting your drugs via mail order. This happens to be a preferred pharmacy for this plan, CVS, so there's going to be lower copays for these drugs. This individual is just taking 2 medications. Both happen to be tier 1 generics, a Lipitor generic, and then a blood pressure clopidogrel generic. You can see the cost before deductible. This is the amount that they'll pay at CVS before they reach that $435 deductible is 0. So basically, they're going to pay nothing for those tier 1 generics. And then after the deductible, they're still going to pay 0. So if they had another drug that came in and they reached that deductible, they'd still pay 0. So this is a pretty straightforward for these 2 drugs. They're, again, very inexpensive generic medications. If you go to the preferred pharmacy, that's what you're going to pay each month. Now, it also gives you the total number. You will pay $188.40 per year on drug and premium. That total number is very important. That's actually how we pick the drug plan. We look for the lowest total overall number based upon the 30 different drug plans that are available. So for this individual, the $188 for the year is really just the premium of $1,570 a month times 12 months. So if you multiply that out, you get $188.40. If they happen to have a copay for the drugs, you would see that number would increase. It tells you will not reach your deductible this year. Again, based upon these 2 drugs, that's what the model is based on. You're not going to hit that deductible. And then you get a breakdown by month that it shows you your drug cost. Well, again, this individual at CVS has 0 drug cost, so it's pretty straightforward. There would be no drug cost at CVS. Then everything just repeats now for the next pharmacy, which is Walgreens. So now, and the line breaks on this report are not great. See how the Walgreens kind of starts at the bottom of the page before, but that continues at the top of the next page. But you can see if you go to Walgreens, you can still use the plan, but you're going to pay $7 a month for the copays rather than 0. So if it's a preference for you, you can still do it. But in this case, that's a standard pharmacy with this plan. And then it gives you that number for the year. If you use Walgreens, it's $280. Well, why is that? It's because you're paying the $1,570 a month, plus you're paying the $7 a month for copays. If you add that all up for the year, that's how you get the $280 for the year. Again, you won't meet the deductible, and it just gives you the breakdown for the drugs for each month, which is really the $765 for each of those months with that particular plan. So, and now if you keep scrolling, you're going to see everything repeat for the last time. This is for mail order, which shows you if you get a 90-day supply, you get basically a 0. For these tier 1 generics, you're going to get a 0 copay again. So with this plan, you'd get a 0 copay for 90-day supply via mail order as well. All right. and then it'll break it down by quarter with the mail order costs. It's January, April, July, and October because you're getting a 90-day supply. And again, it's zero copay, so you're seeing zeros there. In the next table, other drug information gives you the tiers of the drugs, if there's any quantity limits or step therapy. This is a pretty straightforward example. They're both tier 1 generics. There's no prior authorization, no quantity limits, etc. for this plan, or for these drugs. And then it gives you the actual drug list that you entered in, so you can verify you entered everything correctly, the right dosage, the right quantity, 30 per month, that's once per day. The other one was also 75 milligrams, 30 per month, once per day. All right? And then the last part here, Part B drugs, chemotherapy drugs not covered. This is confusing to a lot of people. What this means is if the drug is covered by Part B as in boy, it's not covered by Part D as in drug. Chemotherapy drugs are generally covered under Part B as in boy. So the Part B would pay its 80%. If you have a Medicare supplement, it would pay the other 20%. So you wouldn't have an out-of-pocket expense for those Part B drugs in that example. All right, so don't get people get concerned or confused by this. They're not covered by Part D as in drugs. That's what it's showing you in this report. Okay. And then there's a star rating for the plan. This plan happens to have 3.5 stars. The reality is there are not a lot of 5-star plans. In certain states, there's no 5-star plans for these drug plans. Most plans that we're seeing this year in the 2.5 to 4 range, with the majority being in the 2.5 to 3.5 range, as far as the stars go for the ratings. All right. And then there's some contact information, the phone numbers for members and non-members. If you want to call them up, if you want to go to the plan's website, you have a link to do that. So that's just a brief tutorial on how to read these reports. If you have any questions, you can call us at the number you see below. And hope everyone has a great day. Thanks.